there are always exciting updates on the field of precursor conditions. The Gabriel Laboratory focuses on understanding how multiple myeloma develops, and that's looking at both MGUS, so monoclonal gammopathy of undetermined significance, and smoldering multiple myeloma. We're recently presented our abstract on the PANGEA study, which is an international collaboration looking at dynamic biomarkers as a way to predict which patients are going to progress from precursor states to overt myeloma with end organ damage. And being able to identify which patients are at the highest risk of progression is great, because not only does it allow us to provide early intervention for patients who are at the highest risk of progression, but it also, by further segregating those patients, we can identify those that may not need treatment and thus prevent over treatment in precursor stages. So the PANGEA model, which we presented at this meeting, is a model that uses dynamic biomarkers. It looks at both MGUS and smoldering patients together rather than separating them into distinct buckets. And looking at those disease states as a spectrum allows us to identify patients individually who are at the highest risk of progression at 1, 2, 5, 10, and 25 years out. The results of the PANGEA model show that several different biomarkers, which are examined dynamically over time, can be used to better predict precursor disease progression. And specifically, those are age, creatinine, free light chain ratio, and that's involved, free light chain over uninvolved, M-spike, and a decreasing trend variable for hemoglobin as well. And then we have two different models for PANGEA. So one is going to include bone marrow plasma cell percentage, and the other one is not. So that allows us to look at patients who both have bone marrow biopsies serially over time, but also those who either don't have a bone marrow biopsy that's recent or don't have one at all. And those are usually our MGUS patients. And using those dynamic biomarkers together in one algorithm, the PANGEA models better predict precursor disease progression for individual patients compared to current gold standards. And specifically in our work, we looked at the 2220 model, which is a risk model used for smoldering patients, and it's currently used in clinic as well as in research studies. And we found that our PANGEA models, when compared to 2220 on validation cohorts of smoldering patients, outperforms it using C statistics, which is a standard statistical metric that looks at how well a model performs and is able to predict precursor disease progression. And we saw greater than 10% increases in our model's ability to predict compared to the 2220 criteria that's currently used. And then finally, when we look at the PANGEA model's ability to perform for patients themselves, we saw that 58% of our smoldering patients in that validation cohort were identified as high risk, and those patients were going to go on to progress to myeloma, and they were identified to be in a low or intermediate risk group by the 2220 model. So high risk by the PANGEA model is 58% of those smoldering patients compared to low or intermediate risk in the 2220 model.